We will go ahead and get started in the interest of time. So we do have a PowerPoint that we will share, but we will also be letting our fantastic panelists speak. And so we'll kind of be switching back and forth here. We will have a Q&A section. So please feel free to submit your questions in the chat. You can go ahead and submit them as they occur to you, and we'll try to get to all of the questions. If there are some that we aren't able to get to, we will make a note of those and send out a post-event email to make sure that we get to everyone's awesome questions. So thank you all again so much for joining us. I am going to share the agenda. So as you can see, we'll start with some brief introductions from the panelists, and they will provide a little bit of context about their team and how they came to be. And then we do have some questions that were submitted that we will try to get to, and we will also be answering questions live as they come in. So again, please feel free to submit questions into the Zoom chat at any time. And to get started, I will go ahead and let our panelists introduce themselves. I want to give you guys just a second. I know there's a lot of information on this slide because our panelists do so much fantastic work. So I'll give you a second with that, and then I will switch back so you can see their wonderful faces.
Okay, thank you, Jema. So my name is Robbie Cummins. I've worked in the Department of Neurology for the past 3 years or so. I'm in the movement disorder subspecialty of seven different subspecialties. We have movement disorders, and that's what I do clinical research coordination for. And also within the past couple of years, I've helped to lead the neurology research recruitment team as well.
Janet, would you like to go or me to go first?
All right, go ahead. Sorry, my internet is unstable today, so I'll do my best. My name is Janet Clark, and I work in movement disorders part-time as a research recruitment specialist. So I spend time in the clinic trying to catch up with patients and then reach out to them by phone and email when I'm unable to get them in person. And this is a second career for me. I was an audiologist by training for many years and stopped doing that and took health navigation and older adult research specialist training, which if you don't know about that, you can take a look that up. There are quite a few people through the ORS program. We have a few in our department, but also there are a lot of folks who are interested in positions. So if you're thinking about starting to work to have a recruitment specialist, there are more than likely people who have had some specialized training who would be happy to join your team. So I'll put in a plug for that group.
Hi all, I'm Lex. I'm the program manager here in Department of Neurology. I've been in the department for over 3 years now, and started in movement disorders and now in multiple sclerosis. I've done some work in the with the Latino community and in terms of clinical research, and also supporting the clinical research recruitment program here at CU. And I'm happy to be here today.
I am a recruitment specialist for our subspecialty neuroimmunology. I work primarily for MS. I work closely with those in our Rocky Mountain MS Center clinic here at UCH. Again, just working closely with patients for our recruitment initiatives, and then obviously follow up after that, similar to Janet. And Melinda and I share that role.
Yeah, we work together. So I am a recruitment specialist as well in neurology, immunology, and yeah, we work with multiple sclerosis patients and try to get them into clinical trials and other research opportunities.
Okay. Hey, everyone. My name's Franklin. I'm a neurobehavior recruitment specialist and research coordinator. Neurobehavior is just another one of those subspecialties like Robbie mentioned that we have within neurology. I primarily work on studies for older adults with like memory or cognitive disorders such as like Alzheimer's disease, dementia, like mild cognitive impairment, all FTD, or things like that. So I'm kind of do some of the research coordinator roles as far as like managing visits or coordinating visits and things of that nature. And then also just kind of work for recruitment for just various studies for those like areas of interest or disease diagnoses, like I mentioned.
Thank you all. So as you can see, we have a fantastic group here with a variety of experience and background. So I will go ahead and share my screen again. They have prepared a slide and some information to give you guys a bit of background before we launch into the questions. Can everybody see my screen? Can I get a thumbs up? Okay, I see nods. Perfect. Thank you. I will pass it back now to the panelists.
Okay, so just to give you guys a little bit of a structural background to our recruitment team and our methods. So first and most importantly, we have recruitment specialists. So this role in our department first started in 2012, whenever one of the, I believe, neuroimmunology study coordinators wanted to dedicate some of their time, I believe around 10% of their time, to recruitment. And since then it's grown. More recently, in 2021, we have 8 different recruitment specialists. And those recruitment specialists are often study coordinators who dedicate about 50% of their time to being a recruitment specialist, while also maintaining some of their study coordinator responsibilities. Like Janet mentioned before, we have older adult research specialists within the department too. We have 3. We have 1 older adult research specialist, otherwise known as ORS, in neurobehavior. And we have 2 older adult research specialists in movement disorders too. And we've sort of, every subspecialty is different, mostly because of the size of the subspecialty. So for example, neuroimmunology is likely one of our biggest subspecialties out of 7 for our department. So we have 2 recruitment specialists. Each of those recruitment specialists dedicate around 50% of their time. That's Melinda and Taylor. And as for the ORs, we actually have 2 ORs within movement disorders, which may be the second or third largest subspecialty in our department. And each of those ORs are actually part-time employees, and they dedicate 100% of their time to recruitment. So as Janet mentioned, if you're considering taking on a recruitment specialist or multiple recruitment specialists, it could be the ORS program from the Multidisciplinary Center on Aging could be a route that you could consider. Yeah, and then just to go over a little bit of our key things that we like to do in recruitment here, we have our own recruitment database. So this database is sort of like an internal way to keep track of potential participants' interests. Really, we like to see historical context in the NRD, so that helps us understand what's already been mentioned to participants and how that conversation goes, what is their preferred method of contact, different things like this. And also, we like to keep track of what studies they're interested in, and we have study statuses that people can select throughout time. So if someone's pending contact, or if someone is reviewing ICF, or if they declared that they're no longer interested in the study, we have a way to keep track of that throughout time. So that database is used by our recruitment specialist and by study coordinators and many others within the department. So it's sort of like this collective tool, this glue that holds a lot of our structure together within the department. As far as outward facing tools that we use, we have the Neurology Clinical Research webpage. You can see a screenshot of that here. Yeah, so we use this webpage to not only help people learn about our research initiatives, and what exactly it means to participate in research. But we also have different links to each of our subspecialties. So each subspecialty has a research page that lists their openly enrolling studies. And we keep that up to date throughout the year. Another good thing to mention is, and maybe the most important tool that we have, is in-person events. And you can see where I bolded in person here because it truly does matter whenever we're trying to make connections, that it be a human connection. Whenever we're seeing if people want to participate in research. So just consider that if you think that your department's struggling in recruitment, consider maybe making a calendar of upcoming in-person events and create some type of team. In the words of Haley Steinert, our director, start small. So, if you're thinking of creating some type of recruitment team within your department, start with one recruitment specialist and see where you can go from there. Yeah, also we have other different tools. We release a neurology research catalog that's not listed here. It's an annual catalog that lists openly enrolling studies for all of our subspecialties in one document. And we, like I said, we release that annually via email to potential participants that have consented to receive that catalog. We also have business cards. We found it very helpful to include double-sided business cards. So we've put a QR code and the URL on the backside of the business cards, and potential participants really seem to like those. So a couple things to keep in mind. But yeah, overall, just to help you guys understand a little bit more about the recruitment specialist role, whenever someone reaches out to us, we have a recruitment email and recruitment voicemail. And we essentially delegate different incoming interests to the specific research specialist. And then that research specialist makes initial contact. They introduce the study, and they also do pre-screening for any studies that the participant is interested in. And if they pass pre-screening, we forward them to the study coordinator. So in turn, that saves a lot of time for the study coordinator and the study team as a whole. So yeah, that's all I've got for that slide.
Thank you, Robbie. We did have a question submitted in the chat box. Someone was curious, Kaylee was curious, what training does a recruitment specialist go through and what qualities do you look for when hiring for that position?
Yeah, Franklin, would you want to answer that question?
Yeah, so I think generally, as far as like a recruitment specialist, when we come on, we have the kind of the dual role of being a research coordinator and recruitment specialist. So, when we come on, we do shadowing, more shadowing than maybe a typical employee would do for just recruitment roles. And we kind of go through special training and administer some of that training, which I can get to later on as well. But I think the ORS program is really kind of the specialized recruitment specialist training, whereas ours, it's kind of dual with the coordinator role. So we've kind of just developed processes just like training on the recruitment database, shadowing recruitment calls, if it's someone like in Janet's role, shadowing in clinic of how to recruit participants in clinic. So just kind of spending more time on that recruitment side than, just the typical research coordinator roles. But Janet may be able to talk a little bit more about kind of the specialized training with ORS. Ours isn't like quite as specialized, just since it's kind of like dual purpose with coordinator roles.
I'll try. The internet is very spotty today over here, as I mentioned before. So I think that rather than spending a bunch of time talking about the ORS training, there are resources available that would let you know what that entails. But it starts out with health navigation typically, and then goes into the older adult research specialist training. And so for me, because of my past experience, the ORS section was a review because I have a lot of experience with other clinical studies and things like that. But they talked about the informed consent process and did some, some really good training on that with doing some role playing and things like such as that, for instance. But Katie Nearing is the person who has worked on that program extensively, and there are other resources to learn about that. So rather than taking more of your time, I'll just stop with that.
Thank you. We had another question submitted by Sonia. What kind of events have you targeted for recruitment? Are they CU affiliated only, or have you engaged local nonprofits and other organizations?
Yeah, that's a good question. So actually one of our ORs has become more or less known as our event coordinator. I'd love to have him speak to this, but what I will say is most of the events that we go to are local. So we do community events to where if there's a walk or a run, we might have a table set up. There's events on campus that we go to, such as the CUAMC block party or the health and wellness fair. I believe is later this year. But yeah, we do events inside and outside of campus. We try to diversify the events to where we reach other populations as well. But I can also tell throughout this year, we may be expanding just a little bit in terms of how far we're willing to reach with these in-person events. So for example, the ORS, or the Multidisciplinary Center on Aging, also has something called Research Roadshow. So these research roadshows reach out far across the state. This is something fairly new to us, but we're hoping that we can make a presence there. And that also depends on funding, which we're still figuring out. But I don't think it will be an issue when it comes to recruitment. We'll see what we can do.
And I think just adding on to that, a lot of our, PIs or neurologists, they're good about giving talks around the community as well, whether it be via Zoom or other platforms. So some of our potential recruits will come in, saying they heard a talk from, Dr. X, so to speak, like it could be Dr. Potter or other physicians that we have. So I think that's another really good thing that we have that our PIs and providers are good about, is just getting out in the community to provide these like talks and Q&A sessions.
Awesome, thank you. We had another question submitted by Kelsey. She asked, what is the best way you have found for outside organizations? So for example, UC Health, to refer patients for recruitment to active studies at CU.
Yeah, so I'll go ahead and answer this one. So the best way that I can see, or the most communication that I can see between UCH and the university, is actually a new initiative. It's called Recruit, the Recruit tools. So essentially, there are different tools that departments across the campus can use to where, for example, I think one of the most popular tools, I'm not super educated on Recruit tools, but one of the most popular tools is actually displaying research opportunities via My Health Connection, so via the patient portal. In the patient portal, I believe that potential participants can set their preferences for what type of research opportunities that they would like to see, and then they will, I'm not too sure how things go, but eventually pop-ups will appear and say, hey, are you interested in this study? Here are some key eligibility criteria. If you're interested, click yes, or something like this. And there's also more internal mechanisms to where there's like a study coordinator dashboard within Epic EMR, to where study coordinators or the recruitment team, or however your department handles these, you will receive potential participants via Epic. I'm not super aware on how all of this works, but I know that that's a good way that we've been bridging UCH and the university recently.
Yeah, I can touch on that briefly as well. Just as far as the Recruit tools, you can get up to like 3 reports that the Epic team like sends out to you weekly. I don't know kind of what their internal mechanism is, but you can get people that are, I'm interested, that are titled as I'm interested, like Robbie mentioned, where it kind of identifies a study for them based on the parameters that you give the EPIC recruit team, whether it be like age, disease, diagnosis, and kind of things that meet your initial parameters. They can click I'm interested, and you see that in your coordinator dashboard. You can also receive like a preferences one where your study was identified in their research preferences for like interests that they may have. And then a third type of individual you can get is one through like I guess it'd be like through through clinic. I can't remember exactly what the report comes through as, but it's just a patient, that's been seen within like neurology that might be a good fit for your study as well, that they like scan, criteria that you send recruit as well. So there's 3 different reports that you can get weekly, and someone will just monitor those, and the recruit team just wants you to respond to them via Epic Messenger just within a week. So that's been really helpful for that specific study as well. I guess the third one that I was trying to think of, it's titled as treatment relationship. So yeah, those are just 3 different reports you can receive from Recruit that are helpful.
Thank you all so much. We have another question or two in the chat, but so you have been noted, but we are going to shift gears and answer one of the questions that was submitted. So I will go ahead and share my screen and turn it back over to the panelists.
All right, this question is about the challenges that we face recruiting minority groups. So when it comes to minorities, like, this is an umbrella that covers either Latinos or Black communities or all the minorities groups that we want to reach out to. I'm personally familiar with the Latino community, and well, for starters, the first one is going to be the language barrier. That's one of the barriers that we sometimes, when we are working on projects, either as an IIT or a sponsor, we don't plan ahead in terms of like, do we have the people who actually speak the language, or we have the documents ready? So when it comes to IITs, we do have a group here that is a group of Spanish speaker coordinators, me included, that we help translate those materials, to help overcome that barrier. When it comes to the sponsor side, then we usually address that matter from the site initiation visit to make sure we're gonna have those visits to those documents ready and everything in place by the time we have a potential candidate. Because sometimes it happened in the past that we have the candidate, but we don't have documents, and a month go by, and then the patient is not interested in the study anymore. Another challenge is the ability for the participant to attend a visit. This includes having a caregiver. As you know, in the Latino community, well, their work schedule might be different than our schedules. These are people that work 80 hours a week, and they might not have the time to attend. So that's one of the challenges that we have faced. So because of that, and we can actually start exploring the one of the options, right, that we have to overcome that barrier. And one is to have funding, or if you're working with a sponsor, have some sort of vendor who can help you with transportation and stuff like that. And then that way the candidate is more, it's easier for the candidate to come in, and be part of the study. And another one is trust. The community doesn't trust research. And it starts with they don't really know what that is. So we try to connect with the community by going to certain events that happen in the communities, and kind of like making sure they see us, right? Make sure they know we exist. And once you have a connection with with particular community or a pocket of say Aurora, and you might want to maintain that relationship in that you're present, because once you start like connecting with them, now they're gonna come back to, they're gonna come back with some questions, or hey, can you be part of this future event? So you might want to be ready to engage with the communities. And another part with trust is when it comes to information, what kind of information is out there for these groups. So in the past, we have done brain health events in Spanish, where we actually invite providers from CU that speak Spanish, and from Denver Health too. So they all come in, and then they give the whole conference in Spanish. So this is not about recruiting, this is about informing people. I'm just gonna, any like follow-up questions, just let me know, or if anyone else wanna just chime in.
Yeah, I'll just mention real quick that Lex mentioned persisting connection, and that is so important to if you're really considering minority groups, not only with having a physical presence and throwing money at something. You need to show within your structure, within your core structure, that you care. So one of the ways that we do that is through, for example, all of our neurology clinical research web pages now have a translation option to over 100 plus different languages. And it's sort of like this 2-click thing to where people can automatically translate their web pages. Also, Lex mentioned sort of like a translation initiative within our department. So this is a 100% volunteer ran translation committee is what we call it. And full of a couple different people that speak a couple different languages. So it's a very small team, and again, it's volunteer ran, so we don't have something that covers all of what we need to do within a department in terms of translation, but they help us a lot in certain small things that we need with catalog translations, at least from my perspective, catalog translations, and sometimes translating just different small blurbs and stuff like this. Also, if you do have, or if you are considering developing a recruitment email or a recruitment voicemail, consider adding an English section and a Spanish section to your email automatic reply. Or if you have a voicemail, consider adding a press 1 for English, press 2 for Spanish, press 3 for any other language you feel. And that's one of our initiatives recently. So other than in-person events, really consider your structure internally before you pursue other things.
Thank you, Lex and Robbie. Those are excellent answers. Again, we are keeping track of the questions in the chat, but we are going to answer just a couple more submitted questions before we switch back over to the chat questions. So our next question that was submitted is about how your experiences recruiting have changed since COVID, and I will turn it back over to the panel.
Yeah, so I can take this question. As a little background, I've been with the department for 2.5 years, so I haven't been here since the start of COVID, but from past protocol changes I've seen, and kind of I guess adjustments that different study teams have made. I think I can talk a little bit about this one for how study teams have adjusted. I think overall, based on our department meetings and study specific meetings, recruitment kind of seems to be down for most subspecialties, but kind of a shift which, you know, some of your teams may have done this in other departments, but a major shift that we've done is just trying to limit in-person visits if we can. Obviously, not all studies you can do this. But, you know, putting an emphasis on virtual visits for things like consenting visits, if possible. Obviously, like with drug studies and things like that, they may need to be in person with the PI and with the physician. But being able to adapt as much as you can to do like health history, virtual questionnaires virtually, and just only doing like in person when it's needed. Even for one of our drug studies that we have, one of our clinical trials, study participation recruitment was really struggling because it required weekly in-person visits. And this could be challenging, especially, you know, for older adults, and all of these older adults for this study have Alzheimer's disease. So they would need, you know, a caregiver to come with them as well. But one adjustment we've made for that study is, you know, at-home nursing visits, you know, which all of these types of changes obviously need to go through COMERB, and you'll need protocol changes. But since we implemented that at-home nursing visit rather than a participant coming in, I think something like 40 times over 6 or 8 months, now they only just need to come in person, I think, like less than 5 times, because most of the visits can be done from their own home. Some other things that we've tried to do to kind of combat kind of some of these changes from COVID and just increase recruitment as a whole. So we've tried to be more active in the community, like we touched on previously, just with research road shows, like the CU Anschutz block party, like wellness events and provider talks. Also trying to find more ways to reach individuals. For instance, within neurobehavior, with our memory and disorders clinic, we now provide research packets to all new patients in that clinic. So about once a month, we stuff these packets with different research flyers, just so while they're waiting for their provider for like their new patient visit, they can be looking through research opportunities if they choose. So, you know, previously we just had, you know, flyers on the wall or QR codes on the wall, but being able to hand them, you know, a physical copy of some things that we're doing in clinic has seemed to help. Just with some recruitment measures for kind of our memory disorders studies that I work alongside. Also, we have a research catalog that goes out yearly rather. So this just has all of our neurology research studies, and this just goes out to people that are in our recruitment database that we touched on before. So I think it went out to like 3,000 plus people this year. So that's just another way to spread awareness, since we're trying to find new ways to recruit, since it's kind of been struggling from COVID. Also just identifying, you know, new methods of recruitment. It seems like, you know, ever since COVID, people haven't been, especially older adults that I work with, haven't been as drawn to coming in person when it's not required. So just providing new methods to recruit participants, such as like, you know, PIs, you know, pitching their studies at faculty meetings and reminding, you know, providers of what studies they have available, using that recruit tools through Epic. And also through the memory and disorders clinic, we have like a shared list in Epic that, you know, if providers don't have time to talk with a participant about research interests because they're busy with clinic, they can also add them to this Epic list to where, you know, various research coordinators can go in and, you know, see if that participant could be applicable for their study since they voiced interest to their provider. And I think lastly, just a way to combat some kind of recruiting challenges that have been especially prevalent since COVID is just kind of collaboration. So whether it's, you know, the recruitment database or some other method you may develop, just finding a system to where your department can communicate between all their studies. So rather than each study recruiting participants on their own, having somewhere where you can see when a participant was contacted, you know, notes about what they were eligible for, what they were interested in. That's kind of how our internal recruitment database is so valuable, because we all kind of work together on recruitment rather than each study, you know, having their own method or tracking system. So this is just helpful because, you know, a participant may call and initially be interested in study X, they're not eligible. for that study, but then we can, send a message through this database to a study that they could be eligible for, if they also voice interest in hearing about other studies. And then in addition to collaboration, I think just developing monthly meetings for some studies that have similar cohorts of participants that you're looking for is helpful. For instance, for our studies for Alzheimer's disease, we meet monthly to see, what challenges certain studies are facing, refer participants to each other if they've been interested in other studies, and kind of talk about any changes to our protocols or any changes that studies have implemented, just since we're kind of recruiting similar individuals. So I touched on a lot there, but I think those are just some different ideas that you may be able to implement if you've kind of been struggling with recruitment, like a lot of our studies have as well.
Thank you so much, Franklin. Those are excellent points. We'll do one more submitted question and then switch back to the Zoom chat. So our next question is about the benefits and challenges of using social media for recruitment, and what platforms work best for recruiting specific populations.
Yeah, I can touch on this. So I don't have much experience with the social media, but I do think that it's a great way to spread information and, show different clinical trials that we are having. I've tried doing Facebook groups and things like that and haven't had much luck. But if Yama, do you have any input on this? Since you have more maybe experience with it?
Thank you. So I swear I did not submit this question, but as some of you may know, the Clinical Research Recruitment Program does offer paid social media advertisement services. So we use the platform Meta, which is the parent company of Facebook and Instagram. So those are the platforms that we currently have available. We are also exploring other platforms. I would say it very much depends on the type of study. I think there are certain groups age-wise in particular that tend to utilize certain platforms over others, but it's also the landscape of social media is constantly shifting and constantly evolving. So I think it is one of many great tools, but like Robbie highlighted in the beginning, it's not a substitute for those in-person relationships and those in-person events. I think it's just a different type of strategy. So I would say the challenges are, sometimes it's harder to reach the audience you want on social media. You have less control over that, even with the fancy algorithms and the parameters that you can set. There's a lot of potential reach, but there's also nothing like actually immersing yourself in a community and building relationships, especially if there is a specific underrepresented in particular group that you're trying to connect with. So all of that to say, there are many benefits and challenges with social media, and it's something that I'm always happy to chat more about. And we do have a service available if you're interested in working with us on a social media campaign. So anything else that the panelists wanted to say about social media before we kind of switch gears and go back to the questions in the Zoom chat?
Yeah, there are several different external vendors you can also work with. I saw that Emily did put in the chat that they've worked with Build Clinical, there's Bump, there's Center Table. I know that's typically who Children's partners with. There's a cost to those external vendors, just to make everybody aware of it. Jema, I don't know if you said this, we don't charge for our services. So the only aspect that you'll be charged for is the cost of actually putting it on Meta Ad Manager. And that varies. So we're happy to work with Emily and your team if you want to save some money. So feel free to reach out and talk to us. But I am going to go to we had 2 additional questions submitted in the chat. So I'm just scrolling back up. So Jess submitted a question. She asked what continuing education opportunities does the Department of Neurology make available for its recruitment specialists in order to continue to grow and develop their knowledge and experience?
I can answer that. So one of the ones we've been now been doing is the option for not only recruitment itself, but also all our coordinators to be part of a 40-hour what's called like language translator training with the Spring Institute. It's not only Spanish; it's all languages. I mean, not all, but some of our coordinators have taken the one in Spanish. Others took Arabic and Hindi. Those some of the opportunities we have here. We also have the CERCA certification. That's the Certified Clinical Research Professional certificate, which the department offers to all coordinators and recruiters included too.
Yeah, it's also worth mentioning that occasionally there will be certain workshops, recruitment-related workshops that run across our inboxes, and we make sure to communicate that between everybody in the recruitment team. And honestly, the most real continued education is probably in-person events. So just consider in-person events. That has to be probably the best way to get continued education rather than some slides on a computer, so just try to get out there. And that's probably I would say that's all I've got to say for that one. Do you have anything, Taylor?
Are we just referring to the platforms that were best for specific populations? I'd say our platform, our recruitment database, it's very helpful by localizing certain populations, and we can send like mass emails out to certain individuals, which is just really helpful. We can pull reports to just see like the numbers and see who we're communicating with, who we're struggling to communicate with. So I think it's a really good platform for singling out certain populations. Also, third party, I think Kylie was kind of touching on that. I'm not sure how the finances side goes for that, but I know for one of our studies in MS, we use, it's called Study Kick, which just helps us, again, get the MS population that we're looking for, and kind of helps us with the pre-screening process. It's very, it's like a crude pre-screening process. We obviously step in and do a formal pre-screening, but it definitely helps us find those populations because it can be hard, as well as Epic. It's a great platform for us to utilize for those who are in clinic. We use it to kind of, again, screen individuals to see if they'll fit our studies. So I'd say that those are some of the solid things that we've had success in.
Yeah, for sure. And especially if someone is concerned about funding, you'll find that a lot of sponsors for these studies, and I'm sure a lot of you already know this, but many sponsors will offer third-party recruitment platforms that Taylor's mentioning. And that does help. It's sort of redundant if you have a recruitment database and you're also entering data into a third-party recruitment platform. That could be something to consider, but often those services are offered for free. So consider that as well.
Well, thank you for all of that great information. We did have one other question submitted in the chat previously that we have not gotten to. That question was submitted by Catherine. And that was, are there any strategies the recruitment team would recommend to develop relationships with external neurology clinics and neurologists that may aid in identifying research candidates earlier in their diagnosis prior to their being referred to MDC UC Health?
Hi.
I can answer this a little bit. So some of it is relationships developed among colleagues with our faculty members. Many of them have fellows who trained with us who now are at other clinics around the Denver area, whether it's private clinics, Kaiser. So I think a lot of it is talking to some of the faculty about their colleagues and either doctor to doctor letters, or they know each other pretty well. And so they can reach out. And so we've done that on a number of studies, but a lot of it has come through the relationships that they've built with either fellows that they've had or people they've trained with or other neurologists that they know. Neurology is a little bit of a smaller community, so they do kind of have those connections, but I'm sure it's the same for other departments and specialties as well. They often know people around the nation and can talk to their colleagues, and even just reaching out, they recognize each other's names from publications or from papers or poster presentations. So I would just touch base and really communicate with your faculty members if they have connections across the community. And sometimes it's just a person knows another person that knows another person and can make those introductions.
I think it's also worth mentioning that if you're considering trying to make potential research opportunities for potential participants outside of CUAMC, one of the things that we've done is created research flyers. So we have a neurology research interest web form. We create a QR code flyer, and we get that flyer approved through UCH, and then you can ask let's just say UCH to display that flyer outside of CUAMC. And that may require you to ask for that manager's permission to display that flyer in that clinic, but that's something to consider, creating a flyer for just general recruitment within your department and then putting that flyer outside of CUAMC and other clinics.
I know the question was specific about neurology and neurology clinics and neurologists, but I know one thing that I learned when I was a coordinator, and it was outside of the state and outside of CU altogether, but physicians and clinicians are very busy. And so a lot of times sending an email is a disservice because they don't read it and they don't see it. And so it's kind of a thing that is coming out of this is like FaceTime and in person goes a long way. So sometimes just showing up and seeing where you can get that FaceTime, whether it's during their lunch hour, whether they have lunch and learns as a group, and being able to talk to them all together. And so, and then talking about the research study and seeing if you can kind of get them all together at one time. Also, I don't want to, obviously you need to have that conversation with the clinicians, but the front desk staff hold a lot of weight, and getting to know them goes a long way. So that's another kind of an entry point to other clinics. And so I would recommend getting to know those individuals as well, because that worked a lot. For me, it was OBGYNs and women's health clinics. But once again, like Haley said, it goes along, it applies to other specialties as well. There was other questions submitted ahead of time, so maybe we could get to one or two of those. So Jema, did you want to pull those up?
Yes, thank you. We do have a couple more. Let me get the right screen pulled up here. So this question is asking about successful ways that you keep your recruitment organized.
Okay, so I'd like to answer this question, but do you mind going to the next question? I have to grab my computer charger. My laptop's about to die. Sorry.
Yes, no problem. So in the meantime, how do you approach recruitment to organizations?
I can answer that. And so first, like we all just want to send an email and call it a day, but that might not be the most efficient. That's gonna the best strategy is to show up. You know, that's the and in order to do that, you just kind of you want to become familiar with what's going on in the community. If there are any community events that are happening, and if you can just by Googling what the organization you're looking or you're interested in, and then they usually have a calendar. And then once you are already know where they're gonna be, then you just show up there and then you connect with them. And I think that'll be the most efficient way to do it. Another way is that we have a what's a community outreach group here at CU, that they're also familiar with a bunch of events that are happening in the community, and also they already have connections with some of those organizations. That's going to be a way to to start that relationship. And also you might even be able to bring your own table to and be part of those events. Some of them are free, some of them you have to pay for them. The one thing, like the last one we went to, we actually went with Kylie to one of the events. And one thing we do is that we just bring our business cards and then we go booth by booth, and connect with everyone. And just know that those organizations, they're always asking for things too. It's a matter of collaboration. So if you need something from them, they're gonna ask you something back. So be ready to I was wondering if you can help us with a presentation on whatever the topic is. So you want to have the bandwidth you ready for, to help that organization.
Thank you, Lex. Those are very important points. Let's see, we will jump back now to the other question about successful ways to keep recruitment organized. Any thoughts on that from any panelists?
Yeah, so I can touch on this one. I think just like we kind of mentioned earlier, just having an internal mechanism to where study teams can recruit across the department is especially helpful, because if you don't have some type of internal mechanism, I feel that every team is just kind of working on their own rather than kind of working collectively between their studies. So I think also developing, like an email or a voicemail for research recruitment for like your department, especially if you don't already have one. That way you can put this email, whether it be on Encore or different study websites, as the primary contact for that study. So you can filter all of your research interests into one email. And then if you have a coordinator like Robbie, who's monitoring those emails or voicemails, he can distribute them out to the correct coordinator rather than, having a lot of different numbers for different studies, having a centralized location where you're receiving all of your recruitment inquiries. Because a lot of times we see someone that may have voiced interest in a study, they're not eligible for that study, but they may be interested in other studies. And if each coordinator is kind of working on their own and aren't knowledgeable of each other's studies, you can't really help refer to another study. And I think also, like Robbie mentioned earlier, just like having a web form to where participants can fill out online that they're interested in hearing about studies. And then that web form automatically goes to our research email or neuro research email. And then we're able to contact them. So just giving them giving participants different ways to be able to contact us, and just having a centralized location. Also, we have like a really helpful R drive. Within the R drive, we have our recruitment folder, and that provides study teams with a lot of different resources for recruitment, whether it be like pre-screening templates, whether it be like chart review templates or other resources for maybe studies in startup that might not have as much experience with these, or for new coordinators. So yeah, I think just having central mechanisms to kind of consolidate all your recruitment into one place is really the most important thing for that.
Thank you, Franklin, for jumping in. And Robbie is back, but we will wrap up since we just have 1 minute left. There were a couple of questions we did not get to, but again, I will send out an email and the panelists will graciously answer those questions as well. I want to thank everyone so much. Thank you to our fantastic panelists for sharing your amazing wisdom and experience. Thank you so much to our partners in the CCTSI and ODICE office, and to everyone for joining us today. Thank you all so much.
Thank you, everyone. Have a good afternoon.